In conditions of the neck that puts pressure on the spinal cord or spinal nerves, the surgeon may recommend a cervical laminoplasty. The spine in the neck, also called the cervical spine, has 7 bones called vertebrae. The front part of each vertebrae is called the vertebral body except for the first vertebrae. Between most vertebrae is a soft cushion of cartilage called an intervertebral disc. The back part of each vertebrae has a curved section called the vertebral arch. Except for the first vertebrae, each vertebral arch has a bony projection called the spinous process. On each side of the spinous process is a flat piece of bone called a lamina. The vertebral arch of the vertebra surrounds and protects the spinal cord, a column of nervous tissue connecting the brain to other nerves in the body. The spinal cord passes through an enclosed space called the vertebral canal, which is formed by the vertebral arches of the vertebrae. Over time, the cervical spine may develop problems such as a bulging disc or bony growths on the vertebrae called bone spurs. These changes can narrow the vertebral canal and put pressure on the spinal cord or the nerves that branch off of it. The pressure can cause neck pain and stiffness, or pain, numbness, and weakness in the arms or hands. The surgeon will begin by making an incision on the back of the neck. The lamina of the affected vertebrae will be exposed. The surgeon will remove the outer layer of bone from each lamina, forming 2 troughs. If the surgeon uses the open door technique, he or she will cast the rest of the way through one of the troughs and pull open the vertebral arch using the other trough as a hinge. This relieves the pressure on the spinal cord. If the surgeon uses the French door or double door variations, on this technique, both troughs will be used as hinges. This will allow the surgeon to split the spinous process and open the vertebral arch in the middle. Usually, the vertebral arch will be opened on more than one of the cervical vertebrae. Bone graft material along with metal plates attached to it may be inserted in each vertebral arch to hold it open. The surgeon will close the incision with sutures, surgical skin glue, or staples. The neck will be placed in a collar to keep it still while the bones heal.